doing OB emergencies, and I'm going to be assisting with delivery today. When I arrive on scene, I'm going to make sure scene is safe and I have my PPE on. I'm going to ask mom her name, age, and due date, if this is her first pregnancy and if she's seen a doctor for this pregnancy, when labor pains started and how often they've been. I'm going to ask her if her water's broken, if she's noticed any bleeding below, if she has the urge to push or use the restroom. I'm going to examine mom for crowning and feel for uterine contractions. As I'm asking mom these questions, I'm going to have my partner take vitals, so blood pressure, respirations, and pulse. So if delivery is imminent, I'm going to control the scene first. I'm going to have anyone who does not need to be in the room for this to leave. I'm going to make sure I have even more PPE on, like a gown or a shield or anything. I'm going to have mom take off her bottoms or assist her taking off her bottoms, anything that might be blocking my view of the vaginal canal. I'm going to position mom either on the bed or the ground with her butt elevated and knees drawn up. I'm going to throw a blanket on mom to keep her warm, but also to give her privacy. I'm going to have my partner at mom's head to make sure she's stable, make sure she's not vomiting, and also to just give mom comfort and coach her through this process. I'm going to keep my OB kit close to me just so I can have everything in arm's reach. And I'm going to make sure to keep my patient warm and also the environment we're in for baby. When she feels the urge to push, I'm going to tell mom to go ahead. I'm going to place a gauze in between the anus and the vaginal opening. As baby's head starts to crown and come out, I'm going to put my whole hand underneath the head to give it space because the fontanelle is very soft and I don't want to hurt it anymore. If I see, as that baby's head's all the way out, if I see an umbilical cord, I'm going to take 2 fingers. I'm going to tell mom to stop pushing first. Take 2 fingers, put it underneath the umbilical cord, and pull it up around the head. After that, I'm going to advise mom to start pushing again. I'm going to help assist take the upper shoulder out and then the lower shoulder. And as baby starts to come out slowly, I'm going to place it on its side to drain out any mucous membranes or anything that might be obstructing the baby's airway. If there is anything that is truly obstructing it, I'm going to suction the nose and the mouth. I'm going to dry the baby off as quickly as possible. As I'm drying the baby off, this will stimulate it, so if it's not crying loud, hopefully it's crying loud enough now. This baby's crying loud and strong. The body is pink, and the extremities are moving great. So I give this baby a perfect ABGAR score. I'm going to clip off the umbilical cord 10 inches above and then 7 inches. Gonna bring over my blankie. I'm gonna place baby down. Gonna clip off. Awesome. Okay, I had written the baby's last name and the delivery time and placed it on the baby's arm. I'm then going to wrap baby in a warm blanket because keeping the baby warm is the most important thing. I'm going to hand baby off to mom. I'm going to advise mom to start nursing if she can. After that's all done, I'm going to wait for the placenta to deliver itself. I'm not going to pull or tug on the cord, but I will assist the placenta coming out. After the placenta's out, I'm going to place the placenta in a bag to bring to the hospital. I'm going to tie it off. I'm going to place it to the side. And then after, I'm going to just kind of help mom clean up just so she doesn't feel completely gross and place a pad over the vagina just to stop any excess bleeding that will be occurring.